In this episode, we will discuss to you everything that you need to know to prepare you, your bitch, and your household for the upcoming C-section. Stay tuned! Welcome back, guys. My name is Doc Cesarean. I'm a licensed vet, and every week we post videos, cases, topics, and tips on how to better take care of your fur babies. And this week, we are going to talk about the things that you need to know before your dog C-section. But before we proceed, please hit like, subscribe, and the bell button so that you get updated for whenever we post new videos in this YouTube channel. We are on Facebook, Doc Cesarean Animal Wellness Center. You can look for us in Timog, UP Town, and North EDSA. And we are also on Instagram, Doc Cesarean Animal Wellness Center, and my personal Instagram, Cesarean. On with our topic for today. Scheduling the C-section. So when do you schedule the C-section? You can estimate a bitch will be due to whelp 63 days after the day she ovulated. So yung ovulation occurs when the progesterone reaches 48 micrograms per deciliter. So how do we do that? You draw blood and run into a machine, which will give you your dog's level of progesterone. At our practice, we frequently schedule C-sections 62 days after ovulation so that hindi ka gigising in the middle of the night kung halimbawang chinempong mo ng 63. Yung 63 kasi pwedeng earlier na 63 or later na 63. So para hindi ka gumising in the middle of the night, 62 days, no? In most cases, 63 days from ovulation is within 24 hours of her ideal due date. However, in some cases, such as in bitches carrying large litters, o kaya yung without precise progesterone timing at the breeding time, this timing may be off by a few hours. A few hours lang naman. Because of this, we recommend you to monitor the last 48 hours before her surgery to be sure that she does not go into labor unattended. A few things indicate an immediate cesarean section. So, ano-ano yung mga yan? Signs of fetal distress, for example, bradycardia doon sa mga fetus. Maternal exhaustion and more than 4 fetuses remaining. Pagod na yung nanay umire, madami pang natitirang puppies sa loob. Systemically unwell bitch or yung in the case of cats, yung queen, no? Kung may problema yung nanay, no? Fetal obstruction of the vaginal vault that is unmovable despite your manipulation, ayaw talaga siyang lumabas. Yan yun, no? Excessive bleeding. Baka merong naputol na umbilical cord o kaya yung placenta, yung the umbilical cord that's connecting the placenta and the fetus. Delikado rin yun. Half an hour of intense contractions without delivering a neonate. Iri ng iri yung nanay, pero walang lumalabas. No? And lastly, radiographic evidence of a disproportionately large fetus or abnormal position. So, ibig sabihin, usually sa mga brachycephalic, yung malaki yung, o kaya kung nag-iisa lang minsan yung fetus, lumalaki siya, na hindi na siya proportional dun sa daanan mismo or yung birth canal na tinatawag. So before the surgery, if you have access to Adaptil, this is a hormone that you give to your dog, no? Yung binibigay natin to 3 days before the surgery Ito yung sinatawag nating adapted or DAP collar. This comes in 2 sizes and emit a pheromone that we believe helps with maternal scales for 4 weeks. Imported to mga to. It's not yet available here in the Philippines. And if you have access to this, if you can buy this abroad, pwede, no? 1 day or 2 prior to her surgery, baka gusto nyo ng paliguan yung inyong bitch, no? So, para, ito pa yung safe na time para to do so. This means she will be cleaner for surgery and for taking care of her puppies. You may also wish to shave part of the abdomen kasi dun dedede yung mga babies paglabas nila. And also, this will minimize the shaving in the veterinary clinic. Para pagdating doon, mas ready na siya, no? You may feed her dinner the night before the surgery, but do not give her food the morning of her surgical procedure. She may have access to water. Walang problema tayo sa tubig until she is ready to travel to the vet. If she is on any medications, she may have those the morning of her surgery. With only enough canned food or cheese to coat the tablet if that is necessary. Ask your vet if you have questions about specific medications. Ito pa, very important. Do not use any topical flea and tick products on her within 1 week of her due date. Ano nga ba yung kailangan nating ihanda before the C-section? What do you need to prepare? In advance of your bitch scheduled C-section, have your whelping area ready for your arrival at home. This includes, so dapat meron kang quiet, warm area, dun sa parte ng bahay mo or a kennel designated for nursery. If you have that, kailangan yung access to this area is also limited sa bata, sa mga tao sa labas, and other pets, no? Kung may iba kang aso na kasama siya. Kailangan mo din ng whelping nest or heated area, no? Para dun sa mga puppies. Whelping and neonatal care supplies, kailangan meron ka nitong following, no? Number 1, rectal thermometer. Meron kang room thermometer para alam mo yung temperature ng room. Kasi pwedeng mag-overheat o masyadong malamig if it's air conditioned. Meron ka dapat heat source. Usually lamp lang naman yan, incandescent bulb. Pero i-avoid mo yung heat lamps that are also fire hazard. So ingatan natin yan. Yung TE scalp whelping nest works great. Okay, yeah, if you have that. Tincture of iodine or betadine for the umbilical cord care. And puppy scale. Bakit kailangan ng puppy scale? Because dapat yung puppies mo, habang dumedede, habang tumatagal, nag-gain siya ng weight. If it's not gaining weight or if it's losing weight, delikado. Record-keeping system for weights, temperature, urine color, and other notes, very important yan. Kung if you have a notebook like this where you can on a daily basis take notes and jot down those information, maganda. Para makikita mo if there's progress, if it's declining or improving or the same. Marking system for puppies, avoid lang natin yung neck bands kasi choke hazards. You also need feeding tube, puppy formula, Medi-Nurser baby bottle, bulb syringe, and Dealy mucus trap. And lastly, you need the disinfectant for the whelping box. So, once you get all those ready, okay ka na. Bring the following with you on her C-section so you may assist with an en route delivery. So, sana hindi ito mangyari habang nasa sasakyan ka, manganak yung bitch, no? In case that this happens, at least ready ka. So, ano yung mga kailangan mong dalhin? Of course, the bitch, yung mga anak, kailangan mong dalhin, no? Your charge cell phone, a tarp or a vinyl tablecloth to cover the seats or floor of the vehicle. Kasi syempre, it's gonna be very messy. Kailangan you protect also yung vehicle, and your puppies or the dog should be protected from the vehicle as well. Kasi baka mamaya madumi naman yung sasakyan. A large crate for the bitch, blankets and towels, laundry basket or ice chest, yan, pwede yan. Pero syempre, huwag mo isisil yung ice chest kung sakali. Why do we need an ice chest? Para you control the temperature from outside in, no? Bulb syringe and Dealy mucus trap in case she whelps and rat. So, what to expect the day of the C-section? Typically, you will need to arrive 1 to 2 hours prior to her scheduled C-section. At most practices, she will have the following procedures performed. Unang-una, no? Evaluation for active labor, which may include a vaginal examination. Magkakaroon ng digital palpation, titignan kung may contractions na, no? Radiographs, x-rays, or ultrasound to find out if the puppies or the fetuses are still okay and the position, no? An IV catheter placement, usually sa front legs namin to nilalagay. And so, kailangan yan i-shape itong harapan, no? For this kind of procedure. Medications ordered by the veterinarian caring for her, and shaving for her surgery. Also, blood tests drawn and run, which may include progesterone and pre-op blood work if not previously done. What we do also, nirarap namin yung buntot, especially kapag mahaba yung hair or yung coat nitong asa natin. No? Wrapping her tail if she has one to keep her tail clean until she is ready to discharge. So, what happens during surgery? When the veterinary staff are ready to start her surgery, she will be taken to the surgery suite. She will have her anesthesia induced. Then, they will start her C-section. In some practices, you may be invited to the treatment area where the pups are being cared for. It is best to allow highly trained veterinary staff to provide neonatal resuscitation and care. After the pups are resuscitated, the staff will remove the placentas, begin umbilical cord care, proceed with record keeping, and treat any pups with medical conditions, as directed by the veterinarian, of course. They will be moved to an incubator or warming area. Prior to leaving the veterinary clinic, ask if you can help her pups nurse for their first meal. So after nung C-section, a variety of medications will be sent home with you for your bitch and her pups. This may include, number 1, pain medications, usually Metacam yan, Loxicam, or Rimadyl for post-op pain. Kasi syempre, hiniwa, namaga, may pain dyan. Reglan to aid in improve lactation by increasing milk production. Oxytocin are given by the doctor for the milk letdown, usually injectable naman yan. You don't take it at all. If you have Adaptil or TM collar, if not already applied pre-op, to improve maternal skills, binibigay din yan sa'yo. Pinapauwi sa'yo. After her C-section, please watch for the following. Monitor the bitch to be sure she's willing to accept and care for the pups safely. This is very important kasi merong mga nanay na they get confused after, hindi nila alam on how to take care of their newborn babies, no? Na dadaga na, naapakan, minsan nga kinakagat kapag dumedede sila. No? So do not leave the pups with her unattended until you are sure that they are safe. Monitor that she does not lay on the pups. Kasi nga, pwede niyang mahigaan. No? Monitor the pups' weights, temperatures, and urine color twice daily and record para sure ka that they are gaining well and nursing adequately. Bottle or tube feed the pups if they are not gaining well or staying well hydrated. Always have the number of your veterinary clinic for assistance if the pups are fuzzy, not nursing well, have dark colored urine, or are not gaining weight. Monitor also the bitch incision, mammary glands, temperature, and appetite. So, dapat chinecheck mo yan palagi, no? And contact your veterinary clinic if she runs a fever of 39.6 degrees Fahrenheit or fails to eat and drink well or has a firm swelling of the mammary glands or there are abnormalities in the incision itself. No? It is normal for her to have bloody vaginal discharge a few days after the pups are born, slowly changing to gray eventually. No? Contact your veterinary clinic if there is excessive blood, odor to the discharge, or an odd color to the discharge. Your next visit to the veterinary clinic will include tail docking kung kailangan ng tail dock or dew claw removal for appropriate breeds. Usually, ginagawa ko yan 3 to 5 days after birth. You also suture removal for C-section 10 to 14 days post-op. Yung sa nanay naman ito. Deworming at weeks 2, 4, and 6 and 8 for the puppies. And health exam. Health certificates for travel if they need to travel. Microchips if they need microchips. And first vaccinations at 6 weeks. Placing pups in new homes with contracts after 8 weeks of age. So you heard that right. Pinakamababa is 8 weeks, 2 months. Kasi by this time, they're fully weaned, they're already eating solid food, and they've given initial vaccinations already by their attending veterinarian. That's it. If you have questions, please use the comment section below and I will try my very best to answer them. If you want to see me personally for a consult, you can visit any of our 3 clinics and we can make an arrangement for you. Or see any of our very competent veterinarians at our Dogford's Animal Wellness Centers. Timog, Yupitan, North EDSA, and we also have a clinic in Cavite. It's called Wax and Whiskers. You can visit them if you want, no? Please visit our other videos too and see if you can learn from them. Thank you very much for watching. I'm Doc Ford's Resho and see you again next week.